Right, so a lot of people are concerned about Tyreek Hill because he popped up with a foot injury and then missed practice Friday, but all the language seems to indicate that he is going to play this week, so I would be comfortable waiting on him to start, and I think he's going to go off with Tua coming back. When we talk about foot injuries, we get concerned about a midfoot sprain, which connects this first metatarsal to these tarsal bones up here with just a multitude of ligaments, but we're not hearing anything about it being a Lisfranc type midfoot sprain, so that would make me think it's one of these mild collateral ligaments or the collateral ligaments down distally by that metatarsal, which wouldn't really be a cause for concern for holding him out of the game. Keeping on board with the Dolphin players, Jalen Waddle also came up with a quad injury. Typically, it's that rectus femoris muscle, which is this major large quad muscle up here. Quad muscles recover back quicker than hamstring muscles because of the larger amount of slow twitch fibers there, as well as the typical concentric form of injury as opposed to eccentric injury that happens with hamstring. So I'm not overly concerned about Waddle as well. All coach speak seems to indicate that he's going to play this week as well. Staying on board with the Dolphins players, because there's a ton of them that were injured, we have the return of Tua from his concussion. All reports indicate that he was symptom-free pretty soon after his concussion, so I wouldn't have any reservations about starting him up. This is all only short-term that I'm talking about, that I don't have any concerns with him. I am obviously concerned long-term wise just because repeated concussions, they deplete the ATP, they cause axonal degeneration, neuron shearing, all those kind of buzzwords that we get worried about. But in terms of short-term performance this season, aside from a significantly increased risk of him suffering another concussion, I wouldn't be concerned with his performance ability and his ability to elevate the players in that Dolphins offense. There are some supplements that have been shown to help with concussion recovery as well as reducing the severity. So omega-3 fatty acids, flavonoids are another one, and then there's been some preliminary research into creatine as well. People have been asking about Deebo as well because he was in the hospital for 2 nights, and that's a pretty big deal when you talk about being hospitalized because there's criteria for observation, which is about 24 hours, and then there's admission criteria, which is anything over 24 hours typically. So that means that the symptoms were pretty severe. They talked about the lung fluid as well that needed to be drained off, either by medications, unlikely that they needed to drain it off by needle measures. But it still is really odd that he was able to return back to practice so quickly. It's good for him, and it does seem like he's got a good shot at suiting up. But I've talked about before how his respiratory status is really at risk. So I would be extremely wary about starting Deebo, and I would only really do it if you don't have a startable player on your roster. And that's not saying reach for, a waiver dart or anything like that. I'm talking about if you have a player that's within about 3 to 5 rankings of Deebo, then I would start that player over Deebo. They talked about it being a different type of pneumonia than normal. So the most common type of pneumonia is strep pneumo, but there has been an increase in this type of mycoplasma pneumonia, which they call walking pneumonia, which seems like it was more likely what he had because walking pneumonia often goes undiagnosed until it progresses to a more severe form, and people typically present with mild symptoms. So it seems like if you want to learn more on that, Google walking pneumonia or mycoplasma pneumonia. Staying on with 49ers players, let's talk about George Kittle. He popped up with a foot sprain as well, but he was able to log practice, and it wasn't shown to be a midfoot sprain. You typically can't practice for a couple weeks with a midfoot sprain, so the fact that he was able to return out there pretty quickly, sounds like coach speak as well says that he is good to go. There's no way I'm benching Kittle with the tear that he's on right now. I actually have Kittle in addition to Bowers, and I'm just running a 2 tight end set at this point. So no concerns with Kittle. If you hear warning terms like turf toe, midfoot sprain, those are steer away. But in a foot injury that's not designated to be either of those 2 injuries where they're practicing, typically I'm okay with waiting to see if they're going to play and holding off for a substitution last minute. Now, what's going on with Jennings? Maybe Juan, I think that's how you pronounce it. But he has a hip injury that's held him out for 2 weeks now, and they said it's specifically not a hip pointer, which would be a bone bruise to the top of that iliac bone, which is cut off at the top. And in that situation where they're holding someone out, I have a concern that he has a subtle labrum tear. Labrum is the connective tissue that helps lock that femur in place in the joint. And it's not necessarily an operative issue, but what they do is they tend to see how the symptoms are. And if there's significant painful clicking of the hips, significant weakness, then they do consider surgery. So I'm wondering if he has a labrum tear, and they're seeing how he progresses symptom-wise before they make a more definitive answer on whether they're going to be okay to return him back to play with conservative care, with medications, icing, rehab, or whether they're going to pursue an operative intervention. But once again, this is just hypothesizing. DK Metcalf. He is doubtful for this weekend. I don't expect him to play. We diagnosed on video assessment at time of injury that this was an MCL injury that was likely going to hold him off for at least 1 week. At that time, I didn't notice that he also has a bye week coming up after the next week, so I do think he's at risk for missing next week as well. We've talked about before how the MCL, it's rarely repaired surgically, and the reason for that is because it's got a great blood supply, as you notice there. Grade 1 tears are just inflammation. I'm pretty sure that's what DK has because they initially thought that he wasn't going to miss any time. And with grade 1s, you just need to rest it, brace it up for a little bit. It's a 0 to 2 week recovery, but I would err on there being a high risk of him missing next week as well. Some people ask me about Kenneth Walker. I don't know why. He's fine. He just has some dog in him, as we've seen on imaging multiple times in the past. He's good to go. He's an every week start, no questions. I'm trying to steer away from Travis Etienne. He's had limited practices with a hamstring injury that's just been ongoing. He's also got that AC joint sprain. And then he's also got Tank's Big B, who is doing really well. So if possible, I'd pivot away. I actually think that Tank is a good pivot point just because there's a chance that he could re-aggravate this hamstring. T. Higgins is also a player that I'm pretty concerned about because he had a history of that hamstring injury that held him out previously this season, and now he had a late addition pop up on the practice report late Thursday with a quad strain. So another soft tissue injury. We've talked about how quad injuries, although they're not as severe as hamstring strains, when it pops up this late in the week without any kind of positive coach or team speak behind whether he's going to play, it's kind of concerning. So if possible, I would be trying to steer away from T. Higgins this week. Once again, the rectus femoris right there is one of 4 quad muscles. It is the most commonly injured one. It spans 2 joints, which makes it a higher risk for injury. Bucky Irving was a super random pop-up because they ruled him out 2 days ago, and then they said yesterday that he's going to be able to play. So he's got a toe injury, and a toe injury where you get ruled out makes me more concerned about a turf toe, which we've talked about before. Turf toe is an injury to that plantar plate. It's injured in hyperextension of that big first toe, and it's really integral in weight bearing and push-off. So I would, if possible, be trying to steer away at this point in time with a toe injury that initially had him ruled out. I had a lot of people ask me about Christian Darrisaw's injury. Unfortunately, he had an ACL injury along with the MCL, so he is going to be out with season-ending surgery, but he should be back ready to go by next season, about 1 year away. Ladd McConkey, he's been doing great, but he's popped up with a hip injury as well. He's logged limited practices at least, so I'm a little bit less concerned. He likely has a hip flexor strain of this iliacus or this psoas muscle, or possibly a hip pointer of the bruise at the top of that hip bone that we see at the top of our screen. Either way, I would err on him likely suiting up, but expect a little bit of a performance reduction for him. Jaden Reed is off the injury report. He initially popped up with an ankle, meaning that it was almost certainly one of these low ankle ligaments, the CFL, the ATFL. Those would be ones that you're able to play through, so I wouldn't have any kind of concerns about starting him up. Jaden Reed is a must start going forward this season. He's been popping off. Been getting questions to update about Nico Collins. He likely injured that bicep femoris. Once again, 2 joint lines crossed, dual innervation, puts it at high risk for injury. Myotendon disjunction, meaning how far in the tendon extends into the muscle, makes the hamstring a longer recovery, but all signs indicate that Nico Collins is on track to return at the end of that IR period in week 10. So I would hold on to him or trade for him if you don't have him. All signs are is that Jaden Daniel wants to play through what sounds like severely bruised rib or a mild rib fracture. All signs are he shouldn't play this coming week, despite how much we want to see him against Caleb. I think that they're going to take him down to that game time decision like they talked about, and they're going to ultimately rule him out. Even if he's active, expect some pretty significant performance limitation. Along the lines of ribs, I think Diontae Johnson is not injured, and I think they're just holding him out because of the imminent trade that's going to happen, possibly to the Niners. Last but not least, Juju already ruled out this week, and I do think that he's likely going to be out next week as well with the hamstring injury.